Good morning, everyone, and thank you so much for viewing this broadcast program today. We apologize for our delay due to technical unexpected reasons, as always the case when we are using technology. Sometimes this is something that can happen. My name is Paulo Nunes de Abreu, also known in English as Paul Nunes Dia. I am the co-founder of the Fórum Hospital do Futuro, which is an NGO that organizes think tanks and thought leadership sessions since 2006 in Portugal. I am delighted to have here with me in studio Micaela Seemann Monteiro, which is a physician, internal medicine specialist with that holds a competence in medical emergency. She studied medicine at the Heinrich Heine University from Düsseldorf, Germany. She worked as a doctor in Germany, in the United Kingdom, and also in Portugal. She directed for 10 years the National Emergency Services. In this context, she won a Quality Award, and she's also a member of the European Society of Emergency Medicine. Within this scope, she attended several programs, management programs, namely business intelligence in the Nova Information Management School in Lisbon. And in September, she assumes the Directorate of Planning of Organizational Development in SPMS. And within that scope, since 2017, she is the director of the National Telehealth Center and coordinates the SNS Contact Center in Portugal. On my left-hand side, for many of the Portuguese viewers that are seeing us, a very known public figure, which is Adalberto Campos Fernandes, is a Portuguese politician who served as a Minister of Healthcare from the 26th November 2015 to 15 October 2018, and is graduated as a PhD in Health Administration from University of Lisbon, in the New University of Lisbon, specialized in health policies and related matters. So this is my guests here at the studio, and I'm also very, very pleased to have a special guest connecting from Skype from the UK, Lord Nigel Crisp, which is an independent member of the UK House of Lords, where he speaks and works mainly on global health. Lord Nigel Crisp was Chief Executive of the English NHS, which is the biggest health system in the world, with 1.4 million employees. And by the way, it's also, I think, the third of the fourth largest organization in the world, after just the armed forces in US and the Chinese army. He is also permanent secretary of the UK Department of Health from 2000 to 2006. And Lord Nigel Crisp's friendship with Portugal started many years ago, I believe, but was deepened as he was chaired of the Gulbenkian Commission on the Future of Health in Portugal. This was a position he took from 2013 to 2014. He currently chairs the Nursing Now, which is a campaign on improving health globally by raising the profile and status of nursing. Also, he's written a number of books, including Turning the World Upside Down, which is a very interesting book that describes what rich countries can learn about health from the poor countries. So thank you so much, dear guests, for being here with me today. I just pass to Lord Nigel Crisp to start an introductory talk. Then we'll be doing a round of interventions and then open to questions from public that you would like to ask us. By all means, all yours, the floor. Nigel? Nigel?
Hello.
Hi. Good morning. Did you listen to my presentation?
I didn't hear a thing.
Oh, okay, sorry about this. I was already introduced you so it's really a pleasure to have you here, and looking forward to our opening comments to this session.
Do you want me to make my comments now?
Exactly. That will be very useful.
Okay, so I'll take about 5 minutes. Okay?
That's perfect. That's fine.
Okay, thank you. Well, good morning, everybody. And firstly, let me apologise for not being there in person, or indeed for not being able to hear what's going on. But actually, really, firstly, I should be congratulating you on the 40 years of the SNS and the great success that it has been. Although I know that the key for you for the future, just as it is for us in England, is about sustainability. And that's really important. Can I also say it was a great pleasure to work with you on the future of health in Portugal, and I'm holding it up now, so maybe you can see it. Future of health in Portugal, everyone has a role to play. I was really delighted to have a chance to work with great colleagues in Portugal, and I think we produced an and I thank the Gulbenkian Foundation for sponsoring it. And finally, as a preliminary remark, let me also just say thank you for letting me speak in English. I never did manage to master Portuguese. I'm really sorry about that. I should have done. Anyway, let me then just talk about sustainability just for a bit, just make a few opening remarks. And what I'm going to do is make 3 points, really. One about what happens inside the SNS, one about what happens outside the NHS, and then thirdly, and really importantly, and sometimes forgotten, is staffing and what we need to do about our health workforce of the future. Now, underpinning all those 3 points, of course, is the change in disease patterns and the fact that we now have many more non-communicable diseases, diabetes, and so on. And we, here in the UK, just like you in Portugal, still have services which were designed for the old pattern of diseases. Much more illness and hospital and doctor-based, if I can put it like that. Whereas what we said in this report, of course, is that we need things to be much more health, person and community-based. So there's a fundamental big change underpinning everything, which is actually coming from the nature of the way that disease has changed. So let me pick up my 3 points. So firstly, inside the SNS, I keep saying the NHS, inside the whole service needs to become much more community and indeed home-based, electronically supported. And we're already seeing that. Many new models have started to emerge from care and treatment at home, distance monitoring, community links, social prescribing, and so on. And I imagine from our earlier conversation that Micaela will discuss these. We also said in this report that in addition to shifting towards a much more community-based operation and technology-supported operation, there was also a need to rationalise the specialities. I think that you've actually got quite a lot of duplication at speciality level, and I think some of that needs to be rationalised, and the service needs to move much more, as I say, to the community-based service. Now, outside the NHS, there's obviously a very important bit of work about patient engagement and what I know some people call co-production of the patient and the clinician working together on their illness. And the classic example, of course, is diabetes, where the patient probably provides, I don't know what, 100 or 200 hours of self-care during the course of the year, and the clinician presumably provides 2 or 3 hours. You know, you're working together around a shared plan. And that's really important, the engagement of the patient. But the bit I want to stress, because again it sometimes gets lost, is this is much more than about patients. It's also about the involvement of employers, schools, food manufacturers, all kinds of people in society who are enabling people to be healthy. We know, for example, with employers, that going to work and the stress at work can be bad for your health. We also know that going to work and enjoying and being fulfilled in your work is good for your work, is good for your health. We know the same thing about schools, that schools can be stressful and difficult places where people learn bad habits, or they can be places where people learn to be healthy and experience health. And we've got in our country now all our primary schools where the children are expected to do exercise during the day. And indeed, there's one school in Scotland, and this is now spreading, where every day at lunchtime, the head teacher and all the teachers and the children all run 4 times round the playground, which is actually, the grounds, which is actually means they run a mile every day, as slow or as fast as they can. So really important that all those people outside the formal health service have a real role to play in making change happen. And that's why we proposed in our report that you needed some sort of health council that would sort of bring all these people together so that one had a really concerted approach to improving. And then my final point is about staffing. And clearly, if we have the sort of health service that I've just described, which is much more community and health based and much more technology based, communication technology based, then there needs to be a different approach for staffing. Staff need to be much more skilled in partnerships with people, with patients and with each other, and much more tech savvy. And that's really quite a big change and needs to be built in, not just, of course, into the pre-service training, but also into the longer term. But I also want to make a particular point about nursing. Nurses, I think, are the great undervalued and underutilized resource in the health system. And if you think about what's happening in large parts of the world, including the UK, for example, in areas like non-communicable diseases, we now in the UK have nurses like diabetes, chronic obstructive pulmonary disease, and so on. So we have those sort of areas where nurses are playing a bigger role. We see nurses playing a much bigger role in primary care, and we also see them playing a much bigger role in promotion and prevention. And I think this is a real drive that we should be having in every country of the world. And, and as a result of that, we set up a campaign called Nursing Now, which is now in 103 countries around the world. And next year is going to be the year of the nurse and the midwife. And I think one of the biggest challenges we will see, one of the biggest opportunities, will be to enable nurses to play their role to the full. And I think this will be very true in a community-based service. So, colleagues, that's my sort of three thoughts for sustainability. Changes inside the hospital or inside the health service, changes outside, particularly in the wider community, with everyone taking some responsibility for health. And thirdly, changes for the way our health workforce are trained, deployed, and supported, including obviously with technology, and a particular role there for enhancing the role of nursing. So let me stop at that point and hope I may be able to hear some of your conversation and pick up any points later on. Thank you very much.
Thank you so much, Lord Nigel Crisp. This is a very insightful contribution. And I would like now to pass the word to Micaela Seemann Monteiro, who probably could add something. And I apologize for the conditions that we are not in a proper two-way conversation, but we'll survive, I guess.
Thank you, Paola.
Well, good morning, everybody. In the first place, I would like to thank Paul for this kind invitation, and I'm of course honored to be here with Lord Nigel and Professor Adalberto Campos Fernandes. And I'm pleased to have the opportunity to give my point of view on this topic. Some of the things that I will say will, I think, link very well to what Lord Nigel has said. Well, first of all, of course, our society is changing. We have clearly a demographic issue. We become older, which is good. But with age, obviously, chronic diseases come, and we will lose progressively our autonomy. Then it will, there is obviously an issue. We cannot, and I think we must not put all older people into nursing homes. I think we should aim for preserving autonomy as long as we can at home. Life expectancy is increasing here in Portugal, and I think this is a European issue, and the relation between young people and old people are changing. We have more and more older people and less younger people. So this is all this spectrum is changing. And then there is obviously also a dilemma in medicine. It becomes more and more specialized. We get more and more drugs that are personalized and address very specific issues. So on the one hand, we have a very specialized medicine, but on the other hand, we need very much a holistic approach because we are dealing with multi-morbidity and we need care integration. So having said that, we can simply not continue to address things as we are used to do it. As what Nigel already said, we need change, and I think change is actually the big challenge here. Technology is a great opportunity to enable this change, but it is not, in my opinion, change in itself. And I think there is a lot of confusion about this among healthcare professionals, decision makers, politicians, and the society, that putting technology into the society, into the healthcare, will change everything. No, people have to change. And change is always questioning the status quo and the role of physicians, the role of nurses, as what Nigel said, the role of the patient, a more active patient, the role of the family, and the role of the whole community. It's about how care is actually delivered. And, well, now how can technology enable change? This is the big question. And I'm talking about ICT. Well, it can change how care is delivered. And I would like to give you some examples of real-world examples that are already in place in the Portuguese National Health Service, in the SNS. So it can overcome geographic barriers and thereby increase access to care for the patients and access to specialized expertise to professionals. There is, for instance, in the Alentejo, in Beja, there is a hospital. They have a specific multidisciplinary diabetes. They discuss concrete patients' issue, concrete problems with primary care physicians that are scattered in small villages around, who will co-manage their chronic disease. And I'll give you another example, which is in the north of the country, in ULS Alto Minho. They have a very interesting program of telemonitoring of COPD patients, and they at this point they have included almost 75 patients, which is quite a good number, and they achieved a reduction of 50% of unplanned hospital admissions, and which is great. Technology can give, as I said before, access to highly specialized care, even in emergency medicine context. So, for instance, in Coimbra, the neurology department advises in situations of acute stroke the small hospitals in the area, which are about 7, and in the last 3 years they helped more than 2,000 patients in the acute stroke setting to get gold standard of care, even if there is no specialized physician on the point of care. So, but it also can increase productivity of scarce resources. And I will give you another example. For instance, dermatology. If you use store and forward teleconsultation, you can increase productivity a lot. In the last year, it has become mandatory in Portugal to refer patients to dermatology with a photography of the lesion and with clinical information. And we know that between 20 or 40 to 60% of these cases, the dermatologist can return resolutive information to the primary care physician. And the College of Dermatology has established that such a store and forward consultation is needs 10 minutes, whereas a face-to-face consultation with a patient needs 20 minutes. So we can address the problem of scarce resources also with these new forms of delivery of care, and technology is a support. Well, there are plenty other examples where we can also, by using artificial intelligence and other advanced analysis techniques, to automatize processes and to augment information to give a good decision support to healthcare professionals. But also as an NHS, as a healthcare system, we can redesign our relationship with the citizen, and we can try to create a one-to-one relationship with the citizen, and therefore I would like to share with you a small video.
If it's possible to share the... We are seeing the video below.
Um sítio onde pode também consultar temas relativos à saúde e alertas clínicos com a máxima credibilidade, ou aceder ao registro de saúde eletrónico para marcar consulta no médico de família, consultar as suas receitas e boletim de vacinas, ou pesquisar prestadores de saúde e respectivos horários de funcionamento. Um sítio mais intuitivo, mais informativo, melhor. SNS 24, antes de tudo.
Thank you so much for your intervention and for this video that we all, I hope that you like to see it, as we did. Just to conclude this first round of interventions, I will pass now the word to Professor Adalberto Campos Fernandes, that would like to comment in this pool of knowledge that we are seeing shared here today.
Thank you very much. Thank you, Paul, for the kind invitation. Thank you, Dr. Micaela, and thank you, Lord Nigel Crisp. It's really a pleasure to listen to you and to learn with you some thoughts about the importance of National Health Service all over the world. As you know, last year you celebrated in the UK the 70 years of the NHS, and now we are celebrating in Portugal the 40 years of the NHS. We are talking about old and brand new realities, because the future is now, and you pointed out the main points of the issues of sustainability. I should add that besides sustainability, one must think a lot about democracy, and to guarantee the access to healthcare to all the people, and mainly the poor people. And it is the reason why we, in the United Nations and the WHO, we are talking about now the universal coverage. The universal coverage is the goal for the millennium. And probably the universal coverage will be linked with your thought and your idea of rethinking the workforce role in the health systems all over the world. And I fully agree with you that the role of nurses is quite undervalued. And we need to talk with all the professions in health system, and we must build some bridges, because the secret, I should say, is the cooperation, is the network, is the teamwork, and is not to build walls, but to build some bridges, and to have the capacity to put doctors and nurses in a permanent dialogue in order to fulfill the main objective of health systems, that is equity, democracy, and universal coverage for every people. So, thank you very much. Your thoughts are really important, and you should visit us in a very soon delay, because we need to listen to you. Your voice is a very important voice to Portuguese experts and Portuguese politicians, and the work that we made with you in 2013 and 2014, it's really a milestone in the process of rethinking and reanalysis of the Portuguese health system. Thank you very much, and I hope we will see you soon, either in Lisbon or in London. And good luck, and with your tasks, political tasks in the Parliament. And I really wish you the best wishes concerning the soft Brexit, with the best regards to Britain, to the UK, and to Europe. Thank you very much.
It's going to be a very interesting opportunity now to show a video that we have prepared for if it's possible, to show now the video from the nursing. Okay. So now we are going to see the video from the initiative that Lord Nigel Crisp shares. It's a short video that I would like your attention.
Pena, nós não conseguimos.
It's a campaign on improving health globally by raising the profile and the status of the nurses. Okay, just thanks for sharing this very interesting video, Lord Nigel Crisp. And I don't know if you want to do final remarks, because I think we should cut the conversation now because we don't have the good technical conditions. So maybe you'd like to say a goodbye note.
My car and go to Parliament now, so who knows what will happen. But let me also just make reinforce the very good point you made. This is about teamwork. We are in this campaign promoting nursing because I think they're the most underutilised bit of the health system. But it's not a zero-sum game. This is not nurses as opposed to doctors. This is teamwork. We know that quality care comes from teamwork. And actually, if you enhance the role of the nurse, you'll enhance the role of the whole team. And can I also just say to Dr. Micaela, I greatly enjoyed her presentation as well. And what I think was particularly good is there are practical examples now appearing all over the world and in Portugal and beyond. And really important that we learn from those, capture the learning from those, but also spread them. And that they're not just isolated examples, but the normal way of accessing healthcare in the first place, unless you have an accident, is in the community and in the home and so on, and that it is technologically enabled. Technology doesn't do it for you. Technology assists the professional. We still need the professionals, the great professionals we have, and I know in your country, one of the things I learned was the quality of education and the quality of the professionals there. So thank you very much. I've really enjoyed joining in this conversation and hearing what colleagues had to say, and I wish you every success with the Hospital of the Future project. Thank you very much.
Thank you so much, Lord Nigel Crisp. It was really a pleasure to have you here. E, bom, vamos terminando esta sessão, já nos estamos a aproximar aqui da nossa hora limite, temos terminado dentro de 10 minutos, porque tenho aqui a promessa de irmos tomar um cafezinho ainda hoje aqui os três. Agradecendo muito a vossa atenção, passamos agora para português e agradecendo aos vários pessoas que nos estão a visualizar neste momento, terminávamos esta ronda de intervenções com alguns comentários finais. Falámos aqui realmente de que na Lancet há um artigo que critica o Serviço Nacional de Saúde português, mas é evidente que nós estamos no bom caminho, há evidentes casos de sucesso e, portanto, eu estou convencido que o SNS tem todas as condições para se ingrar. Realmente, esta questão do trabalho em equipa no Serviço Nacional de Saúde, a criar as pontes entre as profissões e os grupos profissionais, e começava talvez aqui pelo professor Adalberto Campos Fernandes, o que é que poderia existir no terreno que facilitasse essa criação de pontes?
O que já existe, vamos lá ver, nós não estamos aqui a discutir nem a inventar a roda, nem a discutir algo que não exista. Hoje em dia, por todo o país, a realidade, quem conhece o sistema de saúde de concreto, e não apenas de uma abordagem teórica, sabe que ele é feito hoje todos os dias de trabalho de equipa. De equipa entre médicos, entre enfermeiros, interprofissional e interprofissional, e que essa capacidade de, no concreto, junto ao doente, os profissionais se entenderem e se articularem, hoje é uma realidade. É preciso ir um pouco mais longe, mas tem que ser feito, como foi referido pelo Nigel, tem que ser feito num quadro de discussão aberta entre todos, para que a qualidade do exercício profissional não se perca, porque muitas vezes o voluntarismo é o pior inimigo do sucesso destas medidas e, portanto, ter, perdoem-me a expressão popular, mais olhos que barriga será perigoso, porque este é um processo em que não pode ser posto em causa a qualidade da formação profissional de cada uma das profissões e o que se tem que fazer ao contrário é melhorar, densificar essa formação e estabelecer mecanismos onde a cooperação entre as profissões, o trabalho junto do doente e na comunidade e junto às famílias, feito em equipa, acrescenta mais valor do que o trabalho individual. E não apenas do ponto de vista da sustentabilidade, porque podemos melhorar a racionalização dos custos, mas também da satisfação das próprias pessoas, da própria humanização dos cuidados, porque, como nós sabemos, e para concluir, talvez o melhor ingrediente de uma prestação de cuidados de natureza mais humanizada e mais amiga das pessoas é a proximidade. É a proximidade com as famílias, com os cidadãos, num diálogo muito aberto, com mediadores e com mediação. E eu acredito que o sistema de saúde português, tendo as dificuldades que vai tendo, muito decorrentes de um investimento forte que é necessário fazer, continua a progredir e a fazer um caminho que é um caminho que nos honra a todos nós, em termos nacionais e que projeta internacionalmente também essa ideia.
Sem dúvida. Muito obrigada por essa intervenção. E pegando aqui na palavra para uma última observação, a doutora Micaela apresentou-nos aqui realmente aquilo que tem sido um excelente uso de como é que a transformação digital pode ser empregada com inteligência para obter ganhos reais de saúde. A questão é, havendo uma varinha mágica, qual era o desejo que pediria?
Qual era o desejo que eu pediria? Se eu tivesse uma varinha mágica, eu gostava que houvesse um entendimento transversal, quer da parte política, quer, portanto, da parte dos profissionais, quer da parte dos doentes e dos familiares e, no fundo, de toda a sociedade, que o caminho é um caminho que nós temos que desenhar em conjunto e que as tecnologias de informação, tal como o fizeram em muitos outros setores que foram transformadores, são transformadores porque alteram. Não são eles que alteram, eles capacitam-nos a alterar a forma como nós nos relacionamos, democratizam muitas vezes essa relação, dão oportunidade realmente a uma ação muito mais colaborativa, quer em partilha de informação, mas também em complementaridade de ações, e que, portanto, eu gostava muito que todos estivéssemos de acordo que este é um caminho que nós devemos fazer em conjunto e que é o caminho a seguir. E que é através desse que nós vamos encontrar ganhos muito importantes para a sustentabilidade do serviço, para não acabarmos todos em lares, mas conseguirmos viver com autonomia e de forma com capacidade de decisão, cada um de nós, o nosso futuro e as nossas vidas, não é? E isso é uma mudança de mindset que está a acontecer. portanto sei que está a acontecer, porque convivo com isso diariamente, gostava que fosse ainda mais concertada.
Vamos fazer tudo para que este desejo se realize. Eu queria só chamar a atenção que esta conversa é uma conversa que faz o prelúdio para a sessão de abertura, onde vamos recuperar estes vídeos e estas informações para todos os membros do think tank O Despertar de um Sonho, que faz parte da iniciativa SNS 4 décadas de sucesso. Esta iniciativa foi um reto que me foi lançado pelo professor Adalberto Campos Fernandes, na altura como Ministro da Saúde. Vermos as coisas pela positiva, sem dúvida, tem em si mesmo um efeito benéfico para a mudança que todos queremos que aconteça. Neste próximo dia 29 de outubro, na sede da Microsoft em Lisboa, vai ter lugar esta iniciativa, que é possível graças a um conjunto de parceiros tecnológicos e à presença e à participação de todos os nossos convidados, que muito nos honram, e esperamos que nesse dia, no final desse dia, possamos ter um conjunto de conclusões e recomendações inovadoras para esta transformação, para que este desejo que foi pedido pela doutora Micaela Monteiro possa acontecer. Agradeço muito a vossa presença, muito obrigado a todos que nos ouviram com paciência e apesar das desculpas técnicas. Também um grande agradecimento aqui aos estúdios da Pfizer, que trabalharam laboriosamente para tentar debelar estas dificuldades, e uma vez mais obrigado a todos pela vossa atenção. Bem-haja!